Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Jack, and Jack is 13 years old, holy smokes. And Jack has spastic quadriplegic cerebral palsy, and Jack in a couple of weeks is going to have scoliosis surgery. His scoliosis has progressed to 65 degrees. I thought it would be a good opportunity to talk about a scoliosis. The first thing you need to know is the frequency of a scoliosis increases with the increase in severity of the cerebral palsy. There are 5 levels of involvement of cerebral palsy. The levels of people who can walk who have cerebral palsy, that's level 1 and 2. The frequency of a scoliosis for people who can walk who have cerebral palsy is 0 to 15%. When you go up to level 3, that's people who need assistance to be able to walk. That frequency goes up from 15 to 40%. Now level 4 is someone who may walk therapeutically but is in a wheelchair otherwise. Their frequency of scoliosis goes from 40% to 70%. And then someone who has gross motor function level 5, that's what Jack has, their frequency of having scoliosis is 70 to 90%. So the odds are stacked pretty hard against Jack. So Jack has a 65-degree curve. So 65 degrees. That's that kind of curve. It's a pretty significant curve. So what you tend to see in a scoliosis, and what a scoliosis is just where your spine is no longer upright anymore. It tends to get a side bend to it and a rotation component. So Jack has a 65-degree curve. And what you see in the children who are not ambulatory, who have a scoliosis, is they get this long C curve that usually starts with their pelvis not being level and a muscle imbalance, and then just their posture with growth over time. So let's think about how scoliosis progresses over time. So first you want to think about young children. What I would see clinically is a child would start off with one side that had more stiffness than the other side, and you'd see their legs start to go off to one side. It's called the wind sweeping of the legs is what it's classically called, but legs go off to one side. And when that would happen, it would cause the pelvis to tilt. And once the pelvis tilt, this is often seen, it's called a pelvic obliquity, but the pelvis is higher on one side than the other, or one side is more forward than the other, or often both. Once you see that, that's the base of the spine, right? So the spine is off of that, and you can see with my hip higher on one side than the other, I'm starting to have a curve in my spine too. What you tend to see is often that pelvic obliquity first, and so therapists really need to have an eagle eye about looking for those hips to be level. So those therapists who are working with kids who are from kindergarten to 3rd grade, that's when these things start to happen. So it's really important to pay attention because when it starts off, it's flexible. But over time, that scoliosis starts to get more and more significant, and the back starts not wanting to bend and straighten up as much. When you think about pre-adolescence, if a curve is already 20 degrees or more, it's more likely to continue to progress. And what you see as you start to get collapsing on one side of the trunk, and as they grow, they start to become more and more asymmetrical. Then what happens is when you get to adolescence and you get to those big growth periods, then it's not uncommon for a curve that was kind of, oh, okay, we got a little bit of curve, for it to go kaboom, and you go, what happened here? So a curve can increase by 5 to 10 degrees a year with those big growth spurts that happen in adolescence. And it can even be more with really big growth spurts. What are the things that make it more likely that a scoliosis is going to become progressive over time? For one, we already talked about, if you don't walk, it's much more likely that it's going to be progressive over time. And if the scoliosis starts when you're younger, then it's more likely that it's going to progress over time. People who have cerebral palsy level 4 or 5, so the ones who are in a wheelchair most of the time, it's much more likely to progress. And if you have a scoliosis that's more than 40 degrees before you're skeletally mature, before you stop growing, then it's more likely to continue to get worse. You also see it get worse anytime you see that one hip higher than the other or more forward than the other, or for kids who have poor trunk control. So one of the things I like to talk about are the secondary things that go along with the scoliosis. So these are things, a scoliosis is really hard to change, but the secondary things, those are the things that parents and teachers and caregivers and therapists, those are the things that we can have effect on. So is it so funny? So when you have a scoliosis, that affects your sitting balance. When you have a scoliosis, it affects your ability to reach. The more significant it is, the harder it is for you to reach. The harder it is for you to eat and be fed. And as you become more asymmetrical, one hip is down relative to the other, you get a rib hump in the back, you start to have places on your body where you're getting more pressure on from being in your wheelchair, being places. And so you start to have trouble with skin integrity. So those areas are more likely to have problems. As you start becoming more and more asymmetrical, that this position over time becomes more painful. And this in turn means that caregivers are having a harder time because they don't want their kid to be uncomfortable. The kid is much less symmetrical, so it's harder to position in them and move them. And the other thing you see, especially in kids who have a scoliosis that's 60 to 70 degrees or more, is you start to see that they're having more trouble breathing. This is especially true if they have a poor cough, or you see that collapse of one side of their trunk such that that lung is not expanding well. Given all that, when do surgeons start to recommend a scoliosis surgery? So the research says that they start talking about doing scoliosis surgery when a curve gets to 45 or 50 degrees. Now, it's not just that number. What they do is they look over time at the rate of progress of the scoliosis. And they think about all those secondary things we just talked about. How well a kid is sitting, how much pain they're in, how hard it is to take care of them, how much are they having trouble with their skin, how is it affecting their function. The next thing I want to talk about is how do you prevent a scoliosis with someone that progresses with someone who has cerebral palsy. Well, as we kind of talked about, the cards are kind of stacked against you. There's really no bracing protocol that seems to be effective in someone who has more significant involvement to cerebral palsy. People who have idiopathic scoliosis, that's a big word that means they have no idea why the person has a scoliosis. Those people, you can usually do bracing to help improve their scoliosis. Bracing is not effective for someone similar to Jack. You can do strengthening, but that really only improves function, right? It doesn't really improve whether they have to have scoliosis surgery or not. And you can do all the positioning in the world, but none of it has been found to be effective to prevent scoliosis surgery. So what are the things that you can do? Well, as a physical therapist, I worked really hard to address a child's positioning in all their equipment. So when they're in the wheelchair, I want them to be positioned as well as possible. When they're in their stander, when they're on their tricycle, when they're in their activity chair, when they're in their bath chair, well, all those positions that they're in, I try to make sure that they are positioned as well as possible. In a wheelchair, you can get a custom molded seat. The back and the seat can be molded. You really want to make sure you pay attention to that pelvis position as much as possible as you can fix that pelvis position. That is one of the things that you can do. You want to help them do consistent standing time and more upright time. You want to make sure that you're addressing their tone as much as possible, either through medication or other things that doctors can do with tone. You're paying attention to hip surveillance, how the hips are developing, and you really want to do strengthening to be able to improve function. So Jack is about to have surgery in a couple of weeks. If you want to leave in the comments your good wishes for him, I will promise to relay them on to the family. Also promise that after he has surgery, I will keep you all updated with how he's doing. I hope this is helpful information for you, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye.
If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.